Hi everybody, it's Dr. Newman. Another common question that I get for breast augmentation patients before the surgery is about breast augmentation as it relates to breast cancer. Now, breast augmentation does not change your risk of breast cancer, but the issue is, does breast augmentation change your ability to detect breast cancer? Well, mammographers are trained in doing mammograms on patients who have breast implants. Most of the implants that are now placed are placed behind the muscle, and you can actually see that muscle on the mammogram. So you can tell on the mammogram where the back of the breast is. You then have the muscle, you then have the implant. So the implant is not even behind the breast, it's behind the muscle that's behind the breast. So it should not interfere with the mammogram, although the mammographer needs to know that you have implants and needs to do what they need to do so they can get a good mammographic picture even though you have implants in. There's actually some studies that look at breast augmentation patients and their risk of breast cancer, and what they find is that when breast cancer is found in breast augmentation patients, typically it's found at an earlier stage. Now, the reason for this is not because the implants themselves are protecting patients in any way, but patients who have breast augmentation are just patients who tend to go and get their mammograms, and they do get examined, and they're more comfortable taking their clothing off in front of a doctor and letting a doctor examine them, and that's probably the reason for it. But no, breast augmentation does not affect your risk of breast cancer. It should not affect detection of breast cancer at all.